COVID is something which is known by everyone all around the world. Today, I will be talking about something called as long COVID, which might not be known by many people. So, what is long COVID? Long COVID is the signs and symptoms which persist during or following an infection which is consistent with COVID 19 and which continues for 12 weeks or more. So, when can we say that it is COVID or acute COVID or long COVID? What is the time duration that differentiates between the two? So, from the onset of the symptoms of your acute COVID up to the 4 weeks is known as the acute phase of COVID. Now, when all those symptoms it gets carried along up to 12 weeks or even more than that, that duration is termed as your long COVID. Now, before moving further, it is important to know that not only the adults but also childrens get the symptoms of long COVID. Another important thing to be known by all is it is not necessary for a person to have COVID positive test to get the symptoms of long COVID. Now, this might be confusing. I will explain it. It means that there were and there are still some of the people who has all the symptoms of COVID-19, but they never underwent the test for the same. So unknowingly and unaware, they are carrying all the symptoms from the acute phase of COVID, and that has now been carried along to go to the symptoms of long COVID to become long COVID. So yes, a person doesn't have to test positive for the COVID to get the symptoms of long COVID. Another thing which is very, very important is also not all the people who are hospitalized for acute COVID will only get the symptoms of long COVID. There were some people again who were tested positive for COVID, but they never went to get hospitalized. They got treated at home. So the symptoms of long COVID, they do not differentiate between the people who are hospitalized and who got treated at home. So these four things has to be kept in mind. For long COVID symptoms to be persistent, a person does not have to be hospitalized. The patients who are hospitalized, the people who got cured at home, the people who got tested positive for COVID, and the people who did not do any test at all but they had all the symptoms of COVID. All these four categories of people are not differentiated by the symptoms of long COVID. They all presents with the same signs and symptoms of long COVID. And yes, the symptoms of long COVID has unknown remissions, which means there are flare-ups. Okay, to explain it in simpler terms, it can be that you are having one of the symptom of long COVID now. The next day you can be all right. Like just for an example, you have joint pain. You might have the symptom of long COVID or joint pain, any of the joint, for 2 days. You got cured for that with some of the home remedies and the painkillers. After that, you were okay for 1 week or so, just an example. After that, the same joint pain can come up again. So there is flare-ups and remissions. This is especially for fever. Fever has much of flare-ups in this long COVID sign and symptoms. So moving on to the symptoms of long COVID. So what are the features that a person persisting with the symptoms of long COVID present with? Firstly, fatigue, which is extreme tiredness. The person will complain of a lot of tiredness and weakness, which he or she never experienced before the onset of acute COVID. So even with mild exertion, they complain of fatigue and lethargy. The next most common thing is muscular pain and the joint pain. Yes, also hair loss. This is one of the biggest issue which everyone is facing, hair loss. and this hair loss can also be because of the long COVID. Another thing which is common is the palpitation of the heart. Now, what's palpitation of the heart? It is rapid beating of the heart, or you feel the pounding of the heart. So yes, heart palpitations is also one of the symptom of long COVID. Another thing is insomnia, or the disturbance in your sleep pattern. You don't feel sleepy at night. So yes, sleep deprivation is also one of the symptom. What happens is, okay, this thing is to be known by all that long COVID, it is a multi-system problem. So it can give you kidney infection, sadly, pulmonary abnormal function of the lungs, pulmonary problems, inflammation of the cardiac muscles. There can be inflammation of the heart muscles, which is the cardiac muscles. Yes, and of course, mood swings. Now, mood swings is not only common in the women who has menstruation, but yes, even long COVID gives you mood swings. So this can also be one of the symptom of long COVID. Then what other things? Other extreme fatigue, weakness, muscular pain, loss of appetite. Yes, loss of appetite. You don't feel like eating much and you get dehydrated a lot. So these two is also symptom of long COVID. So these are the basic things: your joint and muscular pain, fever and headache, very common, lethargy, malaise, weakness, fatigue. So these are the basic symptoms of your long COVID. Yes, yes, very, very important, which I was about to miss, is giddiness. Now, giddiness occurs because of the postural hypotension. As we tend to rest a lot in the acute phase of COVID, so what happens is when you wake up from the bed, or when you come to an upright position after lying down for a long time, there is pooling of the blood on the lower limb only. So there is vertigo, of a feeling of vomiting sensation. So all these things, it comes under postural hypotension. So giddiness is also one of the symptom of long COVID. So yes, and not to forget loss of taste and smell, alteration in your smell and taste. This is commonly known by all the people that having the onset of COVID, you have problems with your smell and taste. There is loss of smell or taste, or at least alteration of smell and taste. Now, this can be continued even after 12 weeks, making it the symptom of long COVID. But nothing to worry about, this will eventually come back. So it affects your multi-organs, as I already told about. Now let us move to the treatment part. I will be talking about the basic treatment which everyone can try and do it at home. There is nothing to worry about. Long COVID may sound like the muscular pain and the joint pain, and as it is affecting your multiple organs, it may be sounding dangerous, but everything has its cure. So if you don't want to go to the extreme stage, do start with the basic home remedies, home exercises, home rehabilitation, by which you will feel much better. So moving on to the treatment part, now this long COVID, the rehabilitation part of long COVID, it emphasizes on the general health, general well-being. So the first thing what you have to do is rest. Give time to your body. Take rest if you are having fatigue and weakness. Don't rush to do things. Now rest, it doesn't mean you have to sleep for 10 to 12 hours. Rest also implies to your mental rest. Your mental stress has to come down for your fatigue to go down in itself. So what you can do is keep aside your laptops and your phone. Keep your eyes closed. You can listen to soft music and meditate. That helps in reducing the fatigue in itself. What other things you can do by yourself is, yes, one thing important for relaxation is notice your breathing pattern. Close your eyes, lie down, or be seated comfortably, and you can feel how you can breathe. that induces relaxation, and also practice diaphragmatic breathing exercise for relaxation and not to use the accessory muscles for breathing, and forcefully breathing to cope up with shortness of breath. I forgot to mention earlier in the symptoms of long COVID that yes, chest pain and shortness of breath is also one of the symptoms of long COVID. So if you know what diaphragmatic breathing and forcefully breathing is all about, good. If not, you can check my previous video of the same. I've explained there how to do these two kind of exercise in the video, so you can learn the technique from there. So yes, breathing pattern is important. Learning breathing exercise is important. Another thing is, do not hyperventilate. Hyperventilate means do not breathe in too much of air. Hyperventilate. The name itself it tells us what is hyperventilation. Hyper means too much and ventilate is to breathe. So don't take in too much air that your lungs is not able to take it. So yes, do not hyperventilate because that may cause syncope. You may faint. There may be fluctuation in the blood pressure. So you don't have to practice the breathing exercises too much. There is a limit for all. So for that, yes, you can please go to my previous video of breathing exercise and learn the technique for the same. Another thing what you can do is move. Yes, very important. Movement is important. Why? Because now the first thing I told was rest. Now I'm talking about movement. So these two words are totally contradictory to each other. But what I mean to say, movement doesn't mean that you wake up now and climb up the hill or go to run. That movement is not what I'm talking about. Movement means start with the basic movement. Before coming down from the bed, what you can do is move all the joints in your body. Just the basic movement. There is no a formula to do all these exercises, all the basic movements which each and every one of us knows. Just the basic movement of all the limbs, all the joints which you can think you can do. Just move those limbs, and importantly, do the ankle pump exercise if you have the problem with blood pressure, if you face the problem of postural hypertension, and if you have any heart issues. Now, what is ankle pump movement? Very simple. This is one of the simplest but most effective exercise. Just lie down straight with both your legs straight, and then bring your feet towards you and take it away from you, but in a slightly speed pattern. So if this is your leg, just do this. So what happens is this helps in the improvement of your blood circulation. So that helps you to cope up with the postural hypertension. Yes, so ankle pump movement is necessary. So movement is necessary for one more thing, that is to prevent deconditioning. Now, what is deconditioning? Deconditioning is the physical change which occurs in your body after a prolonged rest or inactivity. So, okay, to explain in a simpler term, deconditioning is your body being adapted to not doing things, your body being lazy. So what happens with deconditioning is it again affects the overall well-being. There can be decrease in the mass of there can be decrease in the muscular mass. It affects your cardiac system, your pulmonary system, and more. Yeah, so deconditioning, to avoid deconditioning also, movement is necessary. Until and unless you make your body work, it will not work. Your body is very lazy, so you have to make it work. So to prevent deconditioning also, movement is necessary. As the saying goes, use it or lose it. So this is the best term to prevent deconditioning, to make its explanation much more clearer. Now, movement. Now, I'm not moving away from the word movement, because this is very, very, very essential for overall well-being. Now, why movement again is, something had just popped up in my mind, but I actually forgot it. Let me just rethink it. Okay. Movement. Oh, okay, yes. Movement. For as I already said, that movement doesn't mean you have to run or walk. Start with the basic things. Now, combing your hair is also one kind of exercise. Girls doing makeup is also one kind of exercise. Every movement you do, it includes exercise. Exercise doesn't always mean you have to hit the gym. So do the basic things like wash yourself, washing utensils, brushing your hair, wearing clothes, changing clothes. All these are also part of your movement. So start from the basic activities. Do not overdo activities. That will increase your fatigue, your body will get tired, and you will be wanting to take more rest, and the circle will go on and on and on. So do not overdo things. Now, it is very well understood that you want to go to the work soon, you want to become fit and fine soon, you want to work from the office itself, you want to move out and have parties. That is all right, but give time to yourself. Love your body so that it will love you back. Do not overdo things. Start with basic activities that can be uh, done much more later. So yes, that was all about the movement. Now about the meal, what you can do if you don't feel like eating much is you don't have to have heavy meals. Have smaller meals, but have that frequently. That is very important. Now you cannot keep the cells of your body hungry. If you keep them hungry, even if you don't feel like eating, they are always wanting to eat uh, nutritions. So if you don't have nutritious food, you will obviously have all the fatigue and weakness and malaise and headache and fever and everything. So even if you are not able to eat food all at once, take small breaks and have small meals, but take that frequently. And frequently doesn't mean you're going to have chips and all the junk food. Have nutritious meal. Have the meal enriched with vitamins and minerals. That is important. So okay, one more thing. Water is important. Do not keep yourself dehydrated. Drink juice, soups, fruit, have fruits, and drink plenty of water. So this was overall basic things what you can do for to cope up with the symptoms of long COVID. And yes, I will tell this again and again. Do love your body. Do not overdo things. There is a lot of time. First, love yourself, then the body will love you back. Another important thing to be known is do not desaturate yourself. Now, there is pulse oximeter in every household, almost every household after the onset of COVID. So that is well and good. Now, when you are checking your oxygen level in pulse oximeter, and even during mild exertion, when there is fall of 3% oxygen level, then that has to be investigated. Do not neglect that. So for that, do not overdo things. Do not desaturate yourself. I think I previously missed one of the important symptom of this long COVID, that is known as brain fog. Now, what is brain fog? It is a condition where you have problems with your memory. You cannot focus on things and you cannot think clearly. So, yes, this is also one of the symptom of long COVID. So, concluding it all, COVID-19, it affects people differently. Different body has different responses to everything. So you need not worry about that. Don't take much of stress. Give time to your body. Don't rush in doing the things. And the symptoms of long COVID will eventually get vanished. Thank you.